Hello, I am here today in the beautiful Ritz Carlton Dove Mountain with Kili, Preitauer, and Justin Neece of i2i Population Health. Thank you so much for being here today.
Thanks for having us.
Of course.
Thank you.
So as a population health company, I'm curious how you would define clinical data integration.
Great question. i2i would define clinical data integration simply as bringing together from the provider side clinical data from their EHR and or practice management system, merging it with health plan and or payer data, which could be administrative or claims data, to obviously focus on driving quality improvement and quality outcomes.
Great. And so what are some of the barriers that you are seeing in the market preventing clinical data integration?
So we've seen really three main areas of barriers or categories. I think the first one is the provider's willingness to share the data with the health plans, and in some ways the health plan's willingness to share the data with the providers. And I think there's a couple reasons behind that, whether it's wanting to make sure that their data is safe, that there are some information security protocols in place. We've seen providers that are concerned around health plans leveraging their data for maybe using it against them for contracting. So there's a lot of different barriers around that, but that's kind of the first barrier to clinical data integration. We've also heard, and this is pretty common, everyone talks about interoperability. What does that mean, right? So a lot of systems out there. There's about 1,000 EMRs. There's a lot of other data repositories. And so it's very overwhelming, and it's a huge barrier for health plans to be able to get data when they have to go to multiple disparate systems. So that's really a big challenge for them. We've heard that cost is a barrier, but I'd say really the fourth one is workflow and analytics. So once a health plan puts a strategy in place to get clinical data, what do you do with it then? How do you integrate it into your workflow, whether it's your quality teams, your care management teams, maybe your finance team, and how do you leverage analytics to really get the most value out of that data?
Very interesting. It makes a lot of sense. And so can you speak of some examples of success stories or even solutions that are making clinical data integration possible?
So around success stories, we have multiple payers that we work with across the country that have brought providers into the fold, and we've had provider customers that have brought health plans into the fold, and we've built collaborative partnerships. And so a lot of it's making sure you find the right provider organizations. For example, we work a lot with federally qualified health centers and community health centers, high Medicaid population, a lot of Medicare patients. And I think the biggest success story that we've seen, it's not just getting data from the providers, it's being able to do bidirectional data exchange. So providing value back to the providers are much more willing to share their data, which is the first hurdle. It's a big deal for them, right? Yeah. And sometimes it's getting member roster information so they can manage the member population. Sometimes it's getting claims data or pharmacy data. So seeing some really great successes where we can bring community partners and community health centers and primary care providers into a collaboration with those health plan partners to share data both ways.
Okay. And so what is some advice that you can offer to a healthcare leader as these new initiatives and technology are becoming more intertwined and the way that healthcare is delivered to people?
Yes, we love to continue to complicate healthcare. We have lots of acronyms for lots of different capabilities and new programs. But I think if we step back and really remember what is the main thing, and the main thing is to keep the consumer and the patient at the center. When we think about regulatory, when we think about reimbursement, when we think about new care delivery models, it gets cloudy. It gets very cloudy, as Kili hit on. More technology continues to come out, which means lots more data and lots more disparate systems. But at the end of the day, I do believe that providers and health plans do want the same thing, and that is to drive better health in these communities. So I think the best advice is that we try constantly to remind our employees is, remember, what we're doing is supporting providers and health plans to deliver better care in communities so that we can drive health care.
Sure. That makes a lot of sense. And so these new healthcare trends, technology trends, they're always emerging constantly and affecting this healthcare industry. So what trends are you keeping your eye on right now?
Well, I think, and I know Kili has a couple, but I think that if you step back, you do see telehealth, is a really big movement. When we think about your last question, how do we drive health and the care of folks in the rural markets? We can't place a hospital, we can't place an urgent care model in every rural part of the United States. So telehealth is going to continue to grow. There's a lot of advancements there. We continue to watch it even from a pop health perspective in working with providers and health plans. They're both very interested in that space.
My answer, I fully agree with what you're saying, and I think to add to that, not sure it's a trend yet, but keeping our eye on Google and Amazon.
Okay.
And, they're looking to disrupt the entire market and go straight to consumer. So just trying to see how they're going to do that. Obviously, everybody's talking about blockchain, which would be supportive behind that, but it's going to disrupt the entire health plan space if we can go direct to consumer. So interested to see what they're going to come up with.
We'll have to keep an eye on that because that will be an interesting move. Well, we're really happy that you were able to join us at the Healthcare Payers Transformation Assembly. And I'm just curious, what do you think are some of the benefits for C-level executives to be a part of such a small, intimate program that we're at right now?
I think intimate is the right word. I run growth for our company, so it's focused on bringing in new contracts. But to be able to sit with somebody at the C-suite level or P&L owner level and have a meaningful conversation, that's both ways. So it's an interview. Are we a good fit for you? Are you a good fit for us? It's been very valuable because we can have more meaningful conversations. And you can accomplish a lot in 30 minutes. So these sessions have been very helpful, and I think they've been very enlightening. And the roundtable that we attended earlier today on clinical data integration was very enlightening to hear 20 different health plans talk about what that means to them and what their strategy is. So the intimacy has been great.
I would also add that I think you guys did a great job in preparation because for us it's really understanding what is on their game plan for the next 12 to 18 months. Everybody has a lot of moving parts and pieces, but for us to understand that questionnaire that you do, the ranking of those questions, it gives us a much more finite, tuning around what is very important to them. The word population health or clinical data integration is it's a lot of words, right? And everybody defines it a little differently. So when you drill in with those number of questions that you guys obviously executed with those attendees, that's very good information for us as well.
Well, that's really great to hear, and we were so happy that you joined us, and I hope you benefited from it as well.
Yes.
And we will hopefully see you at the next.
Absolutely. We'll be there. Thank you.
Thanks, Kara.